Welcome to Tenor Tech, where I solve the problems you didn't even know you had.
In this video, I will show how to take Berberine Dr. Berg step by step. Take 500 mg with meals, 3 times daily for optimal absorption. Start with 1 dose for tolerance, then increase to 3 doses if you feel fine. Pair Berberine with a balanced meal to reduce gastrointestinal upset and improve uptake. Track effects on fasting glucose and energy, and report any side effects to your clinician promptly for safe use. In this video, I will explain how to take Berberine Dr. Berg step by step. Take each 500 mg dose with a meal to reduce stomach upset and boost absorption. Space doses roughly 4 to 6 hours apart to maintain steady blood levels and consistent effects. Avoid taking Berberine at bedtime to reduce possible sleep disturbance. Keep a simple log of doses and symptoms so you can discuss adjustments with your healthcare provider. In this video, I will help how to take Berberine Dr. Berg step by step. Tell your doctor about all medications, especially diabetes drugs, blood thinners, and statins, because interactions can occur. Watch for nausea, diarrhea, or unusual fatigue and pause use if they appear. If you are pregnant, nursing, or on complex medication regimens, get personalized advice before continuing. Keep records of lab values, like fasting glucose, to evaluate benefits safely.
Thanks for watching. Subscribe to keep your life in tune.